Good afternoon, folks. I have A for you. Give me a minute to get comfortable and we will get going on A today for presentation. The title is America's Aging Dilemma. Okay, so let me get comfortable and then we will delve into the presentation I made for you. Back up. Okay, please join me for today's presentation. First headline: the U.S. is not ready for its aging population. Research explains why. Then the second one is America's aging dilemma. Okay, then researchers from Northeastern University highlight that the U.S. lacks adequate infrastructure and policy to support its growing aging population, despite not yet being a critical issue or social issue like in countries such as Japan and South Korea. The aging trend is accelerating, and without major policy reforms, future needs may go unmet. Okay. Discrepancies in accessibility. Using GPS data, census stats, and EPA info, researchers evaluated how well older adults could access essential services like grocery stores, healthcare, and housing, while nationwide discrepancies weren't significant. In the fairness index, the fairness index revealed considerable regional variations. For example, Florida shows more favorable policies tailored to aging populations. Arizona and California present mixed results, with some areas performing well and others poorly. Data-driven insights. Communities were labeled high aging, 50% plus residents age 65, or low aging, 20% aged 65, and their access to services within 5-mile radius was analyzed based on visitation patterns. The study didn't confirm broad inadequacy, but did emphasize localized gaps that could create a real challenges for older adults. If you'd like, I can dig into regional differences or help brainstorm care models that could address these gaps. Want to explore it further? Great question, especially given your deep engagement with frailty aware and memory friendly care models. Here's a synthesis of Some of the most promising and forward thinking solutions being proposed across research policy and practice. Urban design and infrastructure. 15-minute cities. Designing communities where essential services, healthcare, groceries, social spaces are accessible within a short walk or ride, boosting mobility, autonomy, and mental health. Smart housing, integrating ambient assisted living systems, fall detection, sensors, and memory friendly layouts to support aging in place. Integrated person centered care, life course approach, shifting from episodic disease centered care to models that build and preserve functional capacity over time. Primary based models, embedding geriatric assessments, social supports, and interdisciplinary teams into community health settings. Collaborative care, integrating behavioral health into primary care to address depression and anxiety and cognitive decline in older adults. Technology and innovation, telehealth and wearables, remote monitoring of vitals, medication adherence, and cognitive changes, especially vital in rural community or rural or underserved areas. AI and predictive analysis, tools that anticipate health deterioration, personalized care plans, and support early intervention. Robotics devices like LEQ offer companionship, reminders, and cognitive engagement. Robotic walkers and medication dispensers enhance safety. Policy and systematic reform. Master plans for aging. States like California and Colorado are implementing comprehensive strategies across housing, transportation, and healthcare. Healthcare expansion coverage now includes more telehealth, mental health services, and wellness visits with incentives for underserved regions. Medicaid waivers allow states to experiment with non medical supports like Meals on Wheels and home modifications. Social and behavioral supports, community based programs capable and senior villages, pair occupational therapists, nurses, and volunteers to support aging in place. Mental health access, expanding Medicare reimbursement to include counselors and therapists, especially in shortage areas, caregiver empowerment, training in tech platforms, Care Predict, help families manage care and reduce burnout. Would you like to explore how these could be adapted into frailty aware or memory friendly housing models? I'd love to help you that map out a framework that bridges these innovations with your work. Absolutely. The 15-minute city concept is a fascinating blend of urban planning, equity, and autonomy, which aligns beautifully with your work in memory friendly and frailty aware environments. What is a 15-minute city? At the core, the 15-minute city is an urban design model where residents can access most of their daily needs, work, shopping, healthcare, education, and leisure within a 15-minute walk, bike ride, or public transit trip from their home. It's a response to car dependency and urban sprawl, climate change, and pollution. Social isolation, inequality, inequality in access to services. Key principles. Urbanist Carlos Morlano, who coined the team, out, outlines four pillars: proximity, services and amenities are close to where people live; diversity, mixed use, neighborhoods with varied housing, commerce, and culture; density, enough population to support local business and services; Digi- digital digitalization, tech enabled access to remote work, telehealth, and smart infrastructure. Why it matters for aging populations. The, for the older for older adults and those with cognitive or mobility challenges, the 15-minute city reduces reliance on cars and long commutes. Encourages walkability and social interaction. supports aging in place with nearby healthcare, parks, and community hubs, enables frailty-aware design by clustering services and minimizing travel access. Global implementation. Paris. Schoolyards converted into parks, reduced car parking, expanded bike lanes. Barcelona. Super blocks. Limit traffic and repurpose streets for greenery and play. Okay. Sri Lanka. 15-minute community life cycles for daily activities. Poland. 20-minute neighborhoods with local economic boosts. Philosophical angle. Morno calls it chrono urbanism, valuing time spent living rather than community. It's a return to human-scaled cities that prioritize quality of life over speed. Would you like to explore how this model could be adapted to memory-friendly housing or smart elder care environments? I can help sketch out a framework tailored to your vision. The 15-minute city is a compelling vision for sustainable, accessible urban life, but it's not without its critics. Here's a breakdown of the main concerns raised by urban planners, economics, and community advocates. Okay, equality and inclusion challenges, risk of gerontification. Improvements like walkability and bike lanes can drive up property values, potentially displacing lower income residents. Inclusion of marginalized groups, people with mobility challenges, or those living on the edge of living on the edge of designed zones may struggle to access services, undermining the model's inclusivity. Cultural blind spots. Critics argue the model may not translate well from European cities to North America contexts where histories of segregation and car dependency complicate implementation, surveillance, and privacy concerns. Smart tech outreach, the integration of sensors and data tracking raises fears about surveillance and misuse of personal data. Civil liberties. Some worry that monitoring movement and behavior could infringe on individuals' freedoms, especially if not transparently governed. Mobility and economic limitations. Restricted movement while promoting local living. Some feel the model could limit spontaneity and freedom to travel beyond one's neighborhood. Impact on small businesses. Enterprises that rely on cross neighborhood traffic may suffer if movement is discouraged, restricted. Weather and climate realities. In places with climate weather, e.g., blizzards, heat waves, walking or biking may not be practical year round. Philosophical and practical uh, critiques. Top down planning without deep community engagement, the model risks being technocratic and disconnected from local needs. Messaging and branding. Some argue the term 15-minute city is more slogan than substance. Repacking old ideas without addressing systematic urban issues. Freedom versus sustainability. There's a tension between ergo logistical goals and personal autonomy, especially around car using and travel choices. Would you like to explore how these critiques could be addressed through frailty aware or memory friendly adaptations? I think your systems thinking approach could offer some powerful countered the 15-minute and consultation of our urban planning models. Here are several alternatives, each with its own philosophy, strengths, and challenges. Transit oriented development, or TOD, focuses on building dense mixed communities around public transit hubs. Okay. Encourage a walk. encourages walkable and reduces car dependency, popular in cities like Tokyo, Hong Kong, and San Francisco. Pros: efficiency, land use, and strong transit access. Cons: can lead to gen- uh, gentrification near transit uh, nodes. Smart cities leverages digital and infrastructure, lot and data analysis to optimize urban services, emphasizes sustainability, connectivity, and real-time responsiveness. Pros: tech-driven efficacy, predictive planning. Cons: raises privacy concerns and risks of digital exclusion. 3. New urbanism advocates for wearables, neighborhoods, diverse housing and community. Okay. Housing and community oriented design inspired by traditional town planning and human scale architecture. Strong sense of place and community. Cons: sometimes criticized for sometimes sometimes criticized for idealism and limited scalability. For Garden City movement. Give me 1 second, guys. Originated in the UK, Ebenezer Howard blending urban and rural elements. Features like green belts, self-contained communities, and balanced land use. Pros: emphasizes nature and okay. Pros: emphasizes nature and decentralization. Cons: can be land intensive and hard to profit into existing cities. Polycentric cities promotes multiple urban centers rather than a single downtown care. Reduces congestion and reduces congestion and distributes economic activity. Resilience and regional equity. Cons requires boosts. Okay. Then the cons requires robust infrastructure and coordination. Chrono-urbanism. Related to the 15-minute city, but focuses more on time use and quality of life. Prioritizes reducing time. Okay, now we're down to prioritizes reducing time spent community and increasing time for leisure. Care and community. Okay, pros. Home-centered. Home-centered, flexible. Cons. Still emerging with limited implementation models. Would you like to compare how these models address aging population or frailty design? I think your systems-based lens could uncover some powerful. Okay, guys, so that is A for you. I'll be back on in a little bit for B and C. So give me a little bit for those, and I will be back on with you shortly. For now, Gator Wellness, take care, folks.